good evening, and welcome to another empowering episode of Health Matters, where we dive deep into the conversation that truly matter to your well-being. Now, I'm your host, Fiona, and our topic today is one that touches the lives of many families across Malaysia and around the world, which is breast cancer. Now, when most people hear the word breast cancer, the first thing that comes to mind is a lump. But did you know that not all breast cancer starts with a lump? There are signs and risks that often go unnoticed, and that's what we will be exploring in today's show. Now, we have someone special with us today to guide us through this important conversation. Let us all welcome Dr. Nur Fadhlina Abdul Satar, also known as Dr. Lina, a consultant clinical oncologist at Pantai Hospital Kuala Lumpur. Hi, doctor.
Hi, Fiona. Hello, everyone.
Hi, thank you for being here with us. Now, before we dive into our topic today, could you tell us a little bit more about yourself and what are your roles as a clinical oncologist involved on a daily basis?
Sure, Fiona. I work as a clinical oncologist, which means I'm a specialist that look after patients with the diagnosis of cancer. I treat them with both drug treatment, either chemotherapy, immunotherapy, or targeted therapy, together with radiotherapy, which is more of a local treatment. So that's what I do on a daily basis.
Okay, then we have the right person with us today here. Now, doctor, today's topic is about breast cancer. Often enough, when we talk about, we mention breast cancer, automatically the first word or first thing that comes into everyone's mind is a lump. Now, is a lump always the first or the most obvious sign of breast cancer?
So the short answer is yes, but really what we want is to try and diagnose breast cancer as early as possible. So if possible, we want to catch women without even a visible or palpable lump. Meaning, if we can catch women at early stage, early diagnosis saves lives. So at an early stage, we can deliver treatment to cure women from cancer. But you're right, one of the earliest signs is a lump in the breast, but that is not the only sign. There are other breast changes that can come with breast cancer. For example, skin appearance. I don't know whether you've gone to a shopping mall and bought some oranges.
Yes. I have to say.
Have you seen an orange peel? Do you know what an orange peel looks like?
Yeah.
So they have
the fresh one or the dried one?
Either one, but they have dots, right?
Yes.
So your breast can look like that when you have breast cancer at a more advanced stage. So that's called orange peel skin. You can have skin changes. For example, your nipple is pulled in inwards, so that's different. So, but it all starts from you having body awareness. So if you know what your body looks like most of the time, and then when there are changes, whether you can see those changes. So, for example, nipple changing inside, pulled inside, there's changes on the skin. At a more advanced stage, you will find reddening of the skin or even ulcerated skin.
Oh, okay. So, in that case, at what age should women begin regularly check their breasts or, should go for breast cancer screening, and how often?
Sure, Fiona. So, if we look at our closest neighbor in Singapore, they usually suggest for women to undergo mammogram screening once they hit 40 and above. So for 40 to 50 yearly mammogram, from 50 above, 2 yearly mammogram. But if we look beyond that, for example, in the UK, usually women will be called for screening mammogram once they hit the age of 50 and above, once every 3 years. The truth is, it really depends on you and your family history. So if you have a strong family history, for example, if you have sister or mother, so that's called first degree family, the closest to you, and they have breast cancer, in those cases, you can go for screening earlier, even at the age of 30, then discuss it with your breast surgeon. So the main doctor for you to discuss it with would be the breast surgeon.
Okay, doctor. So, say if we wanted to do, a self-examination at home, how effective it is, and what are the right ways to actually do it?
Sure. So in Malaysia, first thing to say is we don't have national breast screening program. So you don't get invited by Ministry of Health to say, come on in to have mammogram screening. So we don't have that provided, which then means Malaysian women need to be more aware of their body and do self-breast examination. But we know WHO or World Health Organization have recommended actually self-breast examination can be effective in detecting early breast cancer. So I would suggest for your listeners and viewers to go to this website called knowyourlemons.org. They have beautiful lemon pictures to depict the breasts, and they will talk you through how to do self-breast examination. But mainly for you to do self-breast examination, if I may talk it through with you. Okay. So mainly, first of all, if you no longer have periods, so post-menopausal ladies, then you would want to choose the same day of the month. And being practical, you could choose the first day of the month. And then you would be palpating or feeling your breast. So you could choose first day of the month, and then you do it every first of the month so that it's regular. For someone who's having period, the best time would be usually a few days after your last period. So take it 2 days after your last period. And the reason for that is usually pre-period or during period, your breast is more tender, sore, and maybe lumpier. So once all that has come down after your period, so 2 days after or 3 days after, then you can use that as a regular way to keep reminding yourself that's when you do self-breast examination.
Okay, I see. Now, earlier, Dr. Lina, you did mention that when I asked how often do we need to check, our breast, you mentioned it depends on our family history, right? So, can a woman without family history of breast cancer still be at significant risk?
Absolutely, yes. Have you heard of the Angelina effect? So, when Angelina Jolie got her breast cancer and then she had it detected and she was someone who has the BRCA gene. And from there, she went and had more prophylactic mastectomy, meaning removing breasts, removing ovaries to reduce her risk of having breast and ovarian cancer. But really, the truth is, only a small number of patients have genetic changes or genetic predisposition or significant family history that would then increase their risk of having breast cancer. So that would be in perhaps 5% of the public. So most public, right, wouldn't have that history, but they are still at significant risk of breast cancer because of other lifestyle factors, for example, having kids late, not having children, early age of having period, late age of menopause, but most and some of these lifestyle risks can't be helped. But other lifestyle risks can be helped. For example, someone who have a sedentary or inactive lifestyle. So they don't move very much, they're not as active, they're more obese, So they have a higher risk of having breast cancer.
I see. There's really a lot of factors that we cannot pinpoint like this is it, this is it. That's the reason why we got breast cancer, so on and so forth. Now, when we talk about breast cancer, about all this thing, there's a lot of information, and sometimes we get info overload, and we don't know which one to trust and to believe, and there's a lot of myth going out there. So being a specialist, what are the biggest myth or misconception about breast cancer that you frequently encounter?
So one of the biggest myth is I can't eat sugar, or sugar causes, you know, breast
Breast
cancer
cancer.
or cancer, as a very simplistic way of thinking. Most of my
Okay.
patients who have cancer and are on treatment will tell me, what can I eat? What can't I eat? What's the pantang larang? And
Mm,
some patients also will stop having sugar in their diet.
mm-hmm,
But honestly, sugar in moderation is what we need. It's
mm,
literally the fuel or energy that we need to function on a
mm,
normal basis. It's what's important is the type of sugar or the glycemic index of the food that you're taking that matters. So you want you don't want you know simple sugars, for example, in sugary drinks or
mm,
donut laced with lots of toppings and sugar. So those
mm,
burn really fast in a short duration of time. You want something like, for example, oats that can give you sugar for a prolonged duration of time.
mm.
So that's just talking about food, because Malaysians, let's face it, we are obsessed with food.
Yes, I think in short, for me personally, I think everything in moderation is also very important, because in Malaysia there's a lot of good, delicious food. We can't run away from that. As long as we don't overtaking it, I think it should be all right. Yes, I think we still have some time. I have a few myth that I wanted to ask, if whether is it true or not. um some people actually tells me that men can't get breast cancer. Is that true or not?
So being a woman increases your risk of having breast cancer, because your breast is clearly developmentally bigger. But
Mm,
men can definitely get breast cancer as well. But the
mm,
risk of that is much, much less. Much,
mm,
much less. So it's rare.
mm. But it's possible. Okay, that's another one. Wearing underwire bra causes breast cancer. Is it true?
No, you can choose whatever bra you want to wear, but it doesn't really have an effect on formation of cancer.
Mm,
Perhaps you can wear bra, don't wear bra, be whatever the way you want. But I wonder where this thinking came from in terms of wearing underwire bra can cause breast cancer. Perhaps it's because it compresses your rib cage, and maybe that can predispose to what some people think of blood clot, and maybe blood clot has something
mm,
got to do with lump. Perhaps the thinking is from there, but
mm,
this is absolutely not true. Blood clot is not cancer. Cancer is really a growth, a
mm.
group of cells that is growing in an uncontrolled manner.
Mm, all right, so I got my answers today. Because really, since last time, there's someone actually telling me, okay, you better not wear underwire bra because it can cause breast cancer, so on and so forth. So I hope that person actually got the answer from Dr. Lina itself. So yeah, thank you, Dr. Lina, for spending your time here today with us, shedding light on such important topic. And your insights has reminded us that awareness isn't just about fear, it's about empowerment, early action, and informed choices. Thank you, Dr. Lina. Now, to
No
all our
worries.
viewers and listeners, breast cancer doesn't always announce itself with a lump like saying, "Hello, I'm here." Sometimes it whispers through subtle signs. So listen to your body, stay informed, and don't hesitate to speak to a healthcare professional. If you have any concerns or simply want to take charge of your health, remember that Pantai Hospital Kuala Lumpur is here for you with experts, specialists, and comprehensive screening services. If you found today's episode helpful, please feel free to share it with your friends and family or someone you care about. Now, thank you for joining us once again on Health Matters. Until next time, stay safe and take care of yourself.